Okay, so welcome everybody to today's video where I'm going to talk about digital health careers and roles with Simon Noel, who is Head of Nursing Informatics in a large NHS hospital trust. So welcome, Simon, and thank you for giving your time today.
Welcome. It's absolutely fine. Yeah, my pleasure.
Thank you. So I thought it'd be helpful, Simon, just to start with a brief overview of your career to date.
Okay, so I actually have been working in NHS since 1986. I qualified in 1989, and shortly after qualifying, went to work in adult intensive care. I spent getting on for well, the next 10 years, I was either staff nurse, senior staff nurse, or charge nurse working in adult critical care. And then in about 2002, when I was working as a charge nurse in the current organisation, um, the organisation had been using at that point for about 8 years a bedside patient information system. The system manager left, and I was asked at quite short notice to take over. I took over, and with only a week's handover, and only being a bit nerdy at the time, took over the running of the information system. Now I was still trying to be a charge nurse in charge of a team at the time, but after a while that I transitioned completely into working, looking after the system and managing that. Um, that actually included a refurbishment of the unit in it. So the subsequent couple of years, I ended up managing the refurbishment of the unit, but also the procurement of a replacement system because our legacy system was going out of support. And that sort of started my digital journey because it meant, doing the procurement, doing the configuration, doing the training and doing the rollout and looking at things like patient safety, dealing with project managers and this sort of thing and companies. So that was very enlightening. In 2009, I was asked to go and work with NHS Blood and Transplant, looking at their paperless transfusion system, to the development of that and integrating that with the other systems such as observation systems and electronic patient records. So I stayed in that role for 8 years, and then in 2017, my organisation created my current post, and I've been in post since 2017. In that time, I've had to work to create a team of digital nurses, and we've been very successful in establishing a robust nursing and now midwifery presence within the organisation. We've rolled out paperless working for nursing, and now midwifery across the organisation. We've looked at standards. I'm now a part of the senior nurse team. I'm sort of integral with all the senior nurse meetings, the harm-free, this sort of stuff. So I've transitioned from being a jobbing clinical nurse, and a specialist clinical nurse to a clinical specialist nurse working with technology, then working through research, and now I've gone into what we call a clinical informaticist role. So I am a clinical nurse specialist working in digital, and that means that I've worked to improve the way that we adopt digital at the bedside, but also you work to make sure that digital works for us as an organization, improving patient experience and the efficiency of the organization. So that's sort of where we are. And the current team, there's about 11 of us at the moment. I've got a couple of deputies. I've got a senior digital midwife. I've got two digital midwives. I've got four digital nurses, and we also have, and we've recruited champions across the organisation, so we have quite a broad spread now.
Yeah. And the role isn't just, well, we're going to talk a little bit about digital roles, but it goes across the professions, doesn't it, Simon? It's
Yes,
not
yes, it
just
does.
specific, which is what you've just said. You've given
Yeah.
a read. Sorry, I was going to say anything
No,
there.
it's fine. No, I think it's one of the things is I think we've recently adopted, we've recently included midwifery in the team. It's always been affiliated with the team, but in the last couple of years, it's become more embedded. And we've tried quite hard to bring allied healthcare professionals into the team, but that's been a more difficult journey at the moment.
Yeah, yeah. So you told us about your current role and sort of key responsibilities. And I see that your role is currently in a large NHS hospital trust, but do we have similar roles in primary
We
care
do,
settings?
yes. I mean, I have a national role as well, and so recently I've been chair of a national digital health panel, and in that panel we have both the HPs but also community digital specialists as well. I have to say that there's the evolution of digital within the community setting is a parallel journey to the acute, but it's in and perhaps not quite as evolved as it could be. There are different needs and different demands upon the community services, and obviously the mix of specialities within communities is somewhat different to what it is in acute. But I think the overall trajectory of alignment of professions and alignment of career pathways is actually very, very clear, and like you can see parallels happening. And even though perhaps community is not quite as evolved as some trusts, there is fluctuation across the country. There is still evolution happening there, and there is still adoption, and there is still development, and there's still opportunity.
Yeah. And what's really interesting is the like you say, the evolution of digital, because when I started my career, we didn't even have computers on the ward, for example. We had paper records, etc.
Mhm.
And I think what a lot of the viewers will be interested in is in the development of roles in
Mhm.
digital health. So could you give a sort of an overview of the types of roles from band five, sort of through like a newly registered nurse, maybe? There might not be roles at that level, I don't know, but an overview of roles from early career nurses maybe going upwards, and what the
Yeah,
responsibilities are.
I think the first thing I would advocate very, very strongly is that anybody who is newly qualified in nursing, and I'm going to apply this to AHPs and midwifery as well, is that they need to consolidate what they've learned. They need to consolidate their learning, they need to consolidate their professional presence, their professional understanding, and their scope within their professional remit. Because
Yeah.
digital is great, and I think with any clinical specialist role, you need to have a firm grounding in practical clinical practice and understand the environment and the culture and the people and the patients and the workloads and the pressures and all the bits that go with it, because you can't just jump straight into a clinical specialist role from educate.
No.
That's my personal strong opinion.
Yeah, yeah, I agree.
So get that grounding first. Get the firm understanding of where you are. I mean, you may want to pick a specialist, or a particular clinical area to specialize in, and that's absolutely fine. But in order to walk the walk and talk the talk, and speak to clinicians and have clinical buy-in and have some credibility, you need to have some experience. Now, that doesn't mean to say that people can't go into digital at band five or band six. That's
Yeah,
absolutely that there are opportunities out there.
yeah.
So we have opportunities for project support officers and educationalists and this sort of thing. I mean, these roles are all over the country in different forms,
Mm,
but you will find that clinicians respond better if you can empathize and demonstrate an understanding of what the challenges they're going through and how things work.
yeah,
So, and I tend to find our clinical specialist digital nurses and midwives are band sevens,
yeah.
and I've made a conscious decision when recruiting these people that they come from an established clinical background. They may be specialists in their areas. So I've got people from acute care, I've got people from trauma, I've got people from theatre recovery, for example, but they all have moved into an established leadership role within their speciality. So they've all been junior sisters or charge nurses. They've all had an opportunity where they've had to cope with a clinical workload, cope
Mm,
with staffing, cope with senior clinical colleagues. So they already have that understanding of what it's like to be in a clinical team.
mm,
So
mm.
when adopting the digital, it means that they can go and talk to their clinical colleagues in a meaningful and robust way.
Yeah.
80% of what we do is people. 80% of what we do in change, evolution, management is about people. And if you understand the environment and the people, then and if you've got a bit of technical savvy about you, you don't have to be a coder or anything like that.
Mm-hmm.
And I would actively say, just at this point, that people who say, "Oh, I want to go into digital because I code," forget that. Don't worry about it. I'm not interested. I'm interested in you as a person. I'm interested in you as a clinical person who can deal with people and has a credible clinical footprint. But also, I'm interested in you as a person who can evolve and develop in that role.
Yeah.
I mean, obviously, you've got to be technically savvy. You've got to understand what you're doing. You've got to be comfortable using computers and technology, and that's fine. But that's as far as it goes. If you're comfortable with word processing, if you're comfortable with doing your general stuff on a computer on a day-to-day basis, that's absolutely fine. It's dealing with the people, which is the important bit. And once you get into those roles, and once you establish into those roles, and you understand how that fits for you, then the opportunities for development through master degrees or short courses or project management courses, this sort of thing, will all help you develop and consolidate that learning so you can go and progress through the digital clinical pathway.
Yeah, that's really important, as you said. It's because people have this idea that the role is very much, you've got to be really literate, computer literate, and have the digital skills. But some of that can be learned, like you say, if you've got a knowledge of it. And it's the people management, because you're actually evolving and implementing change, aren't you, across an organisation?
Yeah, and if you can manage the people. I mean, one of the basic things I tend to do with my nurses is get them to do a project management course first, because if you go to somewhere like Manchester, for example. Now, a couple of years ago, Manchester had a huge rollout of a system called Epic, and the mindset they went around with that wasn't about, oh, we're implementing a digital change. They went about it and said, we're making a workflow change. We're making an organizational change. So they looked at just for the viewers, I mean, if you implement any technical system, if you the functionality will provide opportunities that weren't there before, and it will provide changes in the way that you work that weren't there before. And the understanding is, what is the impact of those changes? What the impact of that additional function, the way it works? So the way your organization, the way you as somebody at the bedside works, will change subtly no matter what you do with your technical systems. So part of it is understanding the operational change and then looking to see how digital works with it. I mean, we in our organization have it's it's clinically led, operationally driven, and digitally enabled. So so it's clinically led, operationally driven, digitally enabled, and that puts those things in order, because it's always going to be a clinical process, and always going to affect us clinically. Operationally, the organisation understand the consequences of the change that they need to make, and digital is there to support it and nurture it, if you like.
So really interesting. So it's very interesting to sort of, you're aligning it to sort of leadership, development, quality improvement, project management, those key
Absolutely.
skills. And I was going to ask you, Simon, what specific skills or transferable skills do you feel that people need in digital health? And you've sort of alluded to you mentioned lots of that already.
Having a good, robust clinical background, being good to manage and dealing with people. Now, you don't need to be a charge nurse or a junior charge nurse to do that. You just need to be in the environment. You need to deal with people on a day-to-day basis. You need to be confident in the way you work. So it's understanding the people, understanding the clinical environment are the two basic things and if you have a good clinical footprint, and if you are experienced in that way, that will always enable you to go into these things. So then the next thing you need is like it's like as you say, QI understanding. It's the understanding of opportunity, development, process, and project. If you can get some of that stuff by doing small things in your environment, it could be You're looking at implementing a new document set, for example, or you're implementing a new way of working to managing bariatric patients, for example. It's understanding that you need to make a change, be that clinical. You need to understand what that change is going to benefits that's going to bring. You need to understand what resources and assets you need to have in order to facilitate that change, and then you need to enable it, enact it, and support it. And if you look at all those components, there is no different to a digital change or a digital project or a digital enablement. They all are transferable. So
Yeah.
if you can do those in your environment on a daily basis, even as a junior staff nurse, then you're equipping yourself to go into this environment.
There are lots of really helpful tips there, Simon, from you. Thank you. So, looking at academia and professional courses, so aligning most healthcare professionals start to align professional courses, their experienced professional courses and any academic courses. Is there anything that you think would help nurses, midwives, allied health professions develop their career in digital health?
So get a good foundation in the baseline postgraduate clinical development. So do the usual courses. They could be something about quality improvement, for example. There could be something about a particular. So, for example, you may want to do the intensive care course if you're intensive care nurse. That's absolutely fine. The important thing there is to understand that those baseline or those fundamental development opportunities will give you tools which make you think better, they make you analyze more, and they make you evolve as a clinician. And all those things will equip you to take that side step into something like digital. So those things are all really, really valuable. Then if you decide to go down the digital route, there's all sorts of things you can do. There's numerous courses around the country now where you can either do say for example, I did my masters at University of Central Lancashire, and it's a master's course. That's fine, but they also do a module which is an introduction to digital healthcare. Now, if you do that, that gives you a real understanding of what digital is, what it's about, and why we're doing it. So that's just one module. So, and there's lots of universities across the country who will be doing digital healthcare courses. And if you don't want to do the whole thing, then perhaps you can just do a module just to give you and equip you what you want to do. If you want to go on to do a master's, that's absolutely fine. If you just want to do a postgraduate diploma, that's absolutely also fine. Those things will all help you and equip you in what you want to do. There are also the other courses around which are a bit more advanced. Before I go on to that, of course, I'll go back to the fact that if you can do a project management course or do some project management development and training, then that will also provide you with the tools you need, as long as some QI training and that sort of stuff. Because all those things, looking at project rollout, project benefits, quality improvement pathways, analysis of process, analysis of risk, analysis of benefit, are all going to be really, really useful. So don't discount any of that sort of stuff. You'll also notice throughout this, at no point am I saying do a coding course, because you don't need to. All right. I'm going to emphasize that again. You do not need to be a coder to be a digital clinical specialist. Just putting that out there.
Yeah.
When you get to the more advanced stages, there are things like, Florence Nightingale do a short course for digital nursing, which is only a week, which is very, very helpful. But it helps you. Florence have a process in which they help you to improve your presence within and improve your confidence and the way you present yourself. So that's really, really valuable. They also do a longer course, which is the fellowship course, which takes a year. That's quite difficult to get on. It's an application and recruitment and interview process. So those are the sort of things that you need to think about. And all these, all the bigger courses tend to have a robust application process with them, rather than just, I want to do it and I'll do it. But things like
Simon, I'm just going to stop you just for a sec, because you said Florence.
Yeah.
What you mean is the Florence Nightingale.
Yes, that's correct. Yes.
It's Florence. I don't know if it's Florence Nightingale Foundation, but Florence Nightingale
yeah.
scholarships.
Florence
Because some
Nightingale
people might not
Foundation.
know.
Yeah, that's fine. So yeah, thanks, Carol.
Yeah.
So there's things like the when you get to more robust point and you're more senior, things like the NHS Digital Academy is good, because they give you a postgraduate diploma in digital healthcare, and you can take that onto a master's if you want to. The Top Hole Fellowship as well, but Top Hole, you have to take some time out. So you work maybe 2 days a week on a specific project to evolve you as an individual. So there's lots out there. I'm just trying to think. There's another one as well. I can't quite think of it in a minute, but I think it's a case of get the fundamentals right, get the basic process and project management right, get the basic QI and benefits right, develop yourself as a robust individual who can deal with others, and those are the things which will get you your foot in the door to a fundamental digital role. And it may be that if you work as a junior, maybe a band 5 or a band 6 staff nurse, within a ward environment, it may be you may find that if a digital role comes up as a clinical educator, for example, or something like that, then that you can step into that quite nicely, and then they will start to grow as you become more exposed to the digital environment.
So fantastic tips there. And also, as a newly registered nurse, you have champions, don't you, sometimes, or early
Yes.
career
Yeah.
nurse or allied health
Yeah.
profession. So do you want to say a bit about that? Or?
Yeah. So what we in our organisation do is we one of the things that we really need is to improve the awareness of the consequence or the implications of digital within the clinical environment, and we are incredibly dependent upon it within our own organisation. So in order to facilitate that, we've gone out and tried to recruit a network of digital champions across the organisation. Those people are just do it voluntarily. We communicate with them on a regular basis. We share with them opportunities for education training, for short courses or seminars or webinars or something like that, so that we can keep them engaged. But in response to that, it's nice that if we deal with these people and talk to them, then things like if there's a problem with their downtime boxes, for example, or the equipment on the ward that they need to feedback, or there's a particular issue to do with a ward smart board or something like that, then those people are the the enablers who help us get that information back. And if there's new processes coming out, those are the people we can communicate with. So it's raising that awareness about digital within the environment. So it's enhancing their primary clinical role with a digital component. And that in itself, if you do have that opportunity, will enable you and give you that opportunity to perhaps build those skills and give you something you can put towards a digital role.
Yeah. And just from you talking, Simon, I'm just thinking about research as well, because nurses, there's more funding for research across the
Yes.
UK. And inevitably, because digital health is increasing, we're seeing
Mhm.
more applications for digital in that. I don't know if you want to talk at all a little bit about research or anything.
Yeah, I mean, we have a very close relationship with the research nursing and AHP cohort within our organisation. And I think the important lesson that we've learned since we've started that relationship is that digital is a enabler for good collection of patient data. It's a good enabler for oversight of patient welfare and practice. And it's a good oversight for the organisation to know where we are with patients, so the patient flows through the organisation, where the bottlenecks are, where the particular issues are, say, with HAPUs or with thrombophlebitis or wound care or anything like that. So it's a rich pool of information for the research cohort. And having that close working relationship with the research team means that if there are particular challenges to do with data collection or there's a particular project coming up, it means that we can help guide them as to where they can get the information and who they can deal with in order to get the information at the back end of the system in order to provide their evidence for their research that they're developing. And I know that you've done some work with the way the digital is being used at the bedside and how we are using the interfaces, and how we're using our hardware and the engagement of the clinical staff. And I think that it's a whole rich pool of research and development and an opportunity to provide a new perspective on the way that we deliver healthcare.
Mm. And the more you're talking, the more I'm thinking all undergraduate programs now should have modules on digital health if they haven't
Yes,
already. I mean, do you think
yes.
that is happening? I mean, I haven't got a clue because I don't work for the university anymore, but
So
what's your
so
view on that?
we've been doing some ad hoc sessions on digital for our pre-registered nursing students, and from September we're going to have a robust sort of a spot on the module for our pre-registration students as well. So So digital will be there because obviously when they get under the wards, particularly with us, that's what they see. That's where they're expected to work. So the sooner we start exposing them to the benefits of what we're trying to do and the challenges and also the opportunities that represents, then the more they're going to get out of it and the more they're going to understand the environment, understand why we're doing it in the way that we're doing it.
Yeah, and it's really interesting about the amount of data that you can sort of collate and take from using the digital. People forget about that as well, because I've seen a lot of research studies recently in nursing, like looking at mortality rates and RN, the data of RN staffing, registered nurse staffing, for example. And some of these studies have looked at retrospective data, and so it's all digital is linked to research. It's linked to everything we do, isn't it?
Yeah.
As nurses now.
Well, it's going to be it's going to be the only way that we're going to go in healthcare in the future. I mean, we whilst paper was fine, paper had its problems. I mean, if you don't have the notes in front of you, then they're stuck in deep storage somewhere, and somebody comes in the front door, and so you've got a complex patient who may be going through cancer treatment, for example. Then, if that information is not in front of you, the risk is that you don't give the patient the treatment they actually need because the notes are in deep storage, some 20 or 30 miles away. With digital, it means that if our clinicians see a patient who is known to our organisation, they can see exactly what's going on with them straight away, and they know which consultant to talk to, which medications they're currently been prescribed, and what part of the treatment pathway they're on. So there's ultimate benefits to what we're doing, and also means we can link specialities together a lot more succinctly.
Yeah. And just thinking about career pathways, and recently we've had the updated critical care pathway. Have you, is there plans, because I know you link nationally, is there a plan for a career pathway in digital health, Simon, or something you can talk about for future plans or anything?
Well, there is. I mean, there's the NHS England have been talking about a workforce plan for digital for quite some time. Now, obviously, that's quite comprehensive because it's not just about the clinical, but it's about the technical and the operational as well on top of that. But having had a sneaky look at one of the draft versions, yes, there is a workforce plan coming out for digital healthcare. There is a workforce plan coming out for clinical digital workflows and the people to support that. So be that obviously nursing midwifery or AHP. So those things are in the pipeline. We've also got a there's the Phillips Ives review, which is still due to come out, which has been delayed a little bit and because of some political challenges. But the idea behind that is to understand not just the careers we need, but also the development we need to succinctly manage that career pathway. Because what we have at the moment, while these courses and things are available, the way that they're implemented and the way that take them up is a bit ad hoc, and the idea is to provide a better and more a more directed pathway for digital clinical professionals within the healthcare system.
Yeah. So that's so helpful, and your overview, you're so insightful because you've got so much knowledge, Simon, about it, but you've put it really in a really practical way as well, which is fantastic. So have you got any advice or top tips? You've given lots anyway, but just summarize any top tips for healthcare students or newly registered nurses thinking about a career in digital health.
Don't make your decision too early. First of all, let yourself consolidate. Understand. Don't go through your student career thinking I want to do that, because when you get to the end of your student career, you think, oh, I want to do that instead. When I finished, when I finished my training, I didn't know what I wanted to do, and I ended up dropping into adult critical care. Now, I would argue that going to adult critical care that early, without any general ward experience, was far too early, because it didn't allow me to consolidate my training before I went into a specialty. So consolidate your training. Go into something which is not too general, but as general as you can be. So it could be a ward nurse jobbing on a general surgical ward or on a medical ward or something like that. Give yourself the opportunity to consolidate and understand what you want and what you need and what the environment can offer you. And once you do that, then if you decide digital is the pathway to go down, starts to understand, well, first of all, make sure you're good with people. make sure you're clinically competent, and make sure you can demonstrate that competence to others, because that will win confidence in others, which means when you go into digital, you can win people over a lot better. Then once you decide you want to go down that pathway, look for those opportunities such as digital champions, or even if it's, going into a short-term contract, into a training program, or to help with a rollout, or to provide support for a particular project. For example, we just implemented Badgernet, which is a maternity system, but they needed people to help train and educate people at the bedside just for the duration of the project. So look for those opportunities and use that to decide what, if that's what you really, really want to do. And if that's what you really want to do, the job opportunities are out there. But the job opportunities will open more the more consolidated your experience is. Doesn't mean to say you need to specialise too much in the first instance, but specialism doesn't really harm you. And then once you've done that, make sure you have a good grounding in QI, a good grounding in education training, a good grounding in perhaps a bit of project management work, or perhaps you've done a QI project where you can combine all these things together. And that will get you in a really, really good place. And with a bit of tech savvy, it means then that if these junior digital roles come up to develop into, then you'll be in the perfect place to go for it and apply for it and see if you can take that first step on the ladder.
Wonderful, wonderful advice. And I've got lots of videos on my YouTube channel summarising QI, the processes, and some examples for early career nurses if
Yeah,
anyone's interested as well. So, so thank you so much for your time today. It's just been amazing listening to you. You're so insightful and have given some wonderful tips, Simon. So thank you for taking, because you've done this in your own time. So thank you very much.
pleasure.